I'm Ohtsu at National Cancer Center Hospital East, Japan. I'd like to present the onset of neutropenia as an indicator of the survival in TAS-102 versus placebo randomized phase III trial in patients with metastatic colorectal cancer. So background of this, this is the ad hoc, post-hoc analysis of the recently published RECOURSE trial, which was the randomized controlled trial comparing the TAS-102 with the placebo in patients with metastatic colorectal cancer who failed the standard treatment. This phase III trial showed the significant improvement of the survival in patients who received the TAS-102, which is a new antimetabolite. The mechanism of action of this agent is shown in Figure 1. And this post-hoc analysis investigated that the correlation between the neutropenia and the overall survival. So Table 1 shows the baseline characteristics of the RECOURSE trial and the patients who were investigated a pharmacokinetic study during this study. In this study, as shown in the Table 2, approximately half of the patients experienced the grade 3 or worse neutropenia during the treatment of TAS-102. And then we compared the overall survival of the patients who developed the grade 3 or worse neutropenia or others. And then, as shown in Figure 2, patients who experienced the grade 3 or worse neutropenia in any cycle show the better survival than patients who were not observed the neutropenia. And Table 3 shows the PK analysis data in patients who were investigated the PK analysis. And this table shows the higher tendency of AUC of TAS-102 in patients who experienced the neutropenia compared with the patients who were not experienced the neutropenia. And there are higher tendency of the neutropenia in Japanese patients as compared with some patients as shown in Table 4. So because of the limited samples of PK data, the cause of the differences between Japanese patients and Western patients not to be elucidated. So in conclusion, patients who developed grade 3 or more neutropenia demonstrated longer median survival times regardless of timing of onset. Delays in TAS-102 treatment were associated with better survival outcomes and higher likelihood of developing grade 3 or worse neutropenia. And there were no significant increases in peripheral reading PK parameters for patients with neutropenia compared with those without neutropenia, regardless of earliest onset. Thank you very much for listening to my presentation.